everybody, welcome to my session. A quick overview of the differences between quality improvement and quality assurance in healthcare. It's a question that sometimes comes up in interviews, and healthcare students sometimes become confused with the terms as well. So I hope you find it helpful. Do give me a thumbs up if you do, and I have a playlist on quality improvement and change management on my YouTube channel if you're interested. So let's start with quality in healthcare. The Department of Health 2008 report defined health quality in healthcare under three criteria: safety, experience of care, and effectiveness of care. And we're constantly aiming to improve quality through improving safety, reducing risks, improving experiences of care, so patients have positive experiences and positive clinical outcomes, and effectiveness of care, reducing waiting times, for example, waste, and streamlining services. Looking at quality improvement in healthcare, there's no single definitive definition of quality improvement. It's an umbrella concept, and it uses systematic approach to improve patient care. So you'll see quality improvement methodical frameworks, models and tools out there that are all aiming to improve healthcare in some way, either through practice, systems or processes. The aim of quality improvement then is to improve patient care through enhancing patient safety, outcomes and experiences of care. Quality improvement involves standardizing processes and structures so that variations are reduced and patient outcomes are improved. So variations might be also reduced with implementing standards, national policies and local policies to standardize care. Patient outcomes might be improved from a change management or a quality improvement project. So an example quality improvement project might be implementing a new dementia pathway to reduce the time from referral to dementia diagnosis. So that dementia pathway is aiming to standardise care and to reduce variation, so all patients coming through that service will receive the same standard of quality care. And the outcome, it would be an improved time, a reduction in time from referral, which means they'll be diagnosed quicker and they can have the correct patients can have the correct interventions can be put in place to support the patient and the family and carers. Quality improvement methods involve frontline teams. There's a strong emphasis on co-production and service user involvement when implementing and evaluating change. And there's a range of quality improvement and change management models out there. And I've got some other videos coming out where I'll be practically applying some of those models. There's no clear evidence base that one model is better than the other. However, we know that quality improvement needs to be systematic, consistent and cyclical, so that you are continuously monitoring whether improvement is sustained or whether we need to improve due to poor quality care. So moving on to quality assurance. Quality assurance is about making sure that quality care happens. You do this through quality care standards that are maintained and clinical risks and harm to patient are reduced. Ongoing monitoring of quality of care must take place against agreed standards for quality to be measured, and we have various strategies, methods and tools used to assure quality of care. We've got risk assessments, audits, service evaluations, for example. When we look at clinical governance in healthcare, the term governance is about a system or framework to manage organisations, and so clinical governance is an overarching system or framework where healthcare organisations are accountable for sustaining and improving the quality of their services and safeguarding standards of care. And healthcare organisations have to evidence those standards are met and that they're maintained to provide quality care. Risk management is about evaluating and predicting clinical risk. So we have risk assessments, for example, a falls risk assessment. We're looking at whether a person has a low, medium or high risk of falls, and the risk assessments inform strategies and interventions. So for example, after a falls assessment, we would be looking at putting in interventions to prevent falls and reduce the risk of injury. Identifying strategies to avoid and minimise risk is the key with risk management, and there's an analysis of data from incidents and complaints across services. If you're looking at strategies to safeguard standards and reduce risk, some examples are here, and they might be good if you're asked in interview. We implement evidence-based standards from NICE guidelines that underpin our policies, protocols, patient care pathways. We have risk assessment and action interventions following assessment, instant reporting and action plans following analysis of incidents, learning from complaints, national reporting and learning systems, escalation pathways to report poor care, areas of concern. We have care quality commission reviews of services and clinical audits and service evaluations. If you're interested, there are lots of additional resources on NHS websites for quality improvement and quality assurance frameworks, models and tools. There are quality improvement hubs across the UK and local quality improvement leads and networks with people with a wealth of knowledge that want to share their project work. We have the Institute of Healthcare Improvement, Healthcare Quality Improvement Partnership and Health Foundation. All have fantastic websites with resources, and then professional bodies and national forums such as the Royal College of Nursing or British Medical Association and other allied professional bodies. I have a video out on what is the difference between research, quality improvement, service evaluation and audit if anyone's interested, free on my YouTube. On my YouTube channel, I've also got a simple overview of research roles, how to become a nurse researcher, and actually it's got a lot of advice that would be applicable to allied health professionals as well, defining scholarship, studentship, fellowships, for example, that's relevant to any profession. Also a video on quality improvement and example service improvement projects for nurses. If you are interested in asking me any questions, do put them in the YouTube channel, or if you want to contact me or network with me, you can DM me on Twitter, my website, and if you're interested in any of my books, I have links to them in the YouTube description. So I hope you found this session helpful. Good luck if any of you've got interviews coming up as well.